So, you guys, this is Amy and Christina from Emerald Bodywork Education. And the thing is, a lot of times we have some very basic education, but it's foundational, and we know that all of us are lifetime learners. But what they're going to talk to us about tonight is really exciting because it's more about rehabilitation. It's really about helping people get back to and find that new normal. And I'm going to turn it over to Amy and Christina, and I'm going to jump over here and open up the chat.
Well, I guess we should introduce ourselves, yes, so that you know, I guess, who we are. That would probably be
Yeah.
helpful because I don't see any familiar faces, which is kind of fun. I'm Amy Scottino. I'm based in just north of Dallas, Texas. I've been a massage therapist in Texas since '02. Been an educator since 2014 in a massage school setting, and then got my license to teach outside of the school in 2021. That's kind of where our Emerald Bodywork Education was kind of organically birthed. We just didn't know it was a thing until it became a thing, because people started signing up for the classes that we kept offering. And so that's kind of where that came from. And so we've been teaching now since 2021, and people keep taking our classes. I want to say it was maybe the fall of 22 or early 2023. I have to go back and look. I submitted and got approved the Oncology Massage Foundational course, A Cancer's Journey. And that was for a very dyslexic person. That was a lot of paperwork to fill out and a big hurdle and stressful situation for me to undertake. But I did it. Not a lot of tears. I did do it. And that was a big accomplishment for me. And it's really a joy to teach, especially with my companion. She'll introduce herself in a second. She brings kind of a different aspect into the classroom that I cannot bring into there. So two heads are always better than one, for sure. I will hand it off to you, ma'am.
Thank you. That's sweet. Amy says a lot of really nice things about me. I am Christina Hughes, the other half of Emerald Bodywork Education. I've been licensed in the state of Texas since 2005 and an instructor since 2019. And then Amy and I did branch out on our own shortly after COVID, when we had to take the foundational program at a massage school and put the whole shebang online and learn how to teach online. In the matter of 2 weeks, we discovered that we could do a lot of things. And so we did. Amy invited me to teach a small little, funny enough, we're going to be talking about Gua Sha tonight. And she invited me to help out / be a student in her first Gua Sha for scar tissue class. And then we just kept teaching from there. And so here we are. So yeah, thanks for inviting us tonight. I would not be sitting here in an S4OM meeting if not for Amy bringing me in and showing me the ropes and helping me understand the importance of S4OM. So I feel very privileged to be here. So yeah, I think there's a lot of therapists out there like I was just a couple years ago that knew of the work and knew of the need for massage for the special population of people living with cancer, but I was not aware of S4OM. So I'm excited to be a part of it now and start getting the word out.
Thank you, Miss Christina. Yeah, so at least in my practice, this phenomenon that I guess in my head has always been like rehab, because that's what PTs and OTs call it. So that's what's in my head. I don't know if that's what massage therapists call it or what's what we should call it. I don't know. I'm not that smart. So that's what's in my head. So that's what comes out of my mouth. So I have been organically, just like probably a lot of other massage therapists, helping people living with cancer. Well, sadly, it can go two ways. I'm going to be honest. We have the sad and the happy. So we don't get to choose that, and we're there for both sides. I'm assuming. I know that I am, and Christine and I have had conversations and shared stories, and I'm assuming everybody listening has also had those similar experiences. So I'm going to talk about the happy side, because why not? A little happy. So I wanted to know if there's numbers to prove what I'm thinking and what I'm seeing in my own little private practice. So I found some numbers. So I'll share them with you guys. So on cancercenter.com, there was a nice article published January 2023. So kind of recent for articles on stats. And it stated, and I'm just going to take snippets because I don't want to read the whole article. It stated that cancer death rate in the US has declined 33% since 1991. Now, I'm not going to say my age, but 1991 does not sound like that far away from me in my head. But then I remember the year that we're in. So I had to read more. Yeah, sorry about that. Bringing us back to reality on that one. So it's not 1991, nor it's 1997. So we're a little further past that age. Okay, so then I read a little bit further. So the recorded US cancer rate peaked in 1991. So I guess that's kind of where they kind of started that. Okay, this is where we're going to start figuring out when it started to decline, because that's when it peaked. And it's been going down every year since. Okay, cool. I wanted to know more. Like, let's get some more specifics. Like, what are we talking here? And so then it kind of started going for, well, what are some survival rates? So according to, and this is American Cancer Society reports, the cancers with the highest survival rates, I was like, ooh, I like those numbers. I want to hear those numbers. And again, this is from January 2023. Thyroid cancer, 98%. I like that.
Wow.
Prostate cancer. Okay. I haven't seen a lot of great prostate cancer outcomes, but 97%. Testicular cancer, 95%. Melanoma, 94%. Okay, those are all 90%. I kind of like that. And then it go down further, and this really got me jazzed up. A number of reported shifts in survival rates since 1975. That still is a far off year. I'm sorry, it is.
Hey, whoa, whoa, whoa. Careful now.
I'm sorry, that's just reality. I'm sorry, Christina, it's reality. We have to remember what year we're in. Okay. A number of reported shifts in the survival rate since 1975 cast a spotlight on how more cancer patients are surviving longer. So it has examples. Lung cancer, 12% to 23%. So 1975, 12%, 2023, 23%. I kind of like that. Female breast cancer, to be specific, 75% in 1975, 91% in 2023. I really like that number a lot. I'm only going to go through two more, unless you want to hear more. Colorectal cancer, this one freaking surprised me. I really did. So 50% in 1975, 65% in 2023. I have two clients that are survivors, which my ears are still like trying to get on that front. Kidney cancer, 50% to 75% in 2023. That fascinated my brain. It just kind of proved, I guess, to my brain that this is reality. What I'm seeing in my practice is real. So we do need to get on board with helping our clients find a new normal, a new functional, healthy, good quality of life normal. What do you think of those stats, Christina? Because I haven't shared those with her yet. That was a surprise for her too.
Yeah, you just said, "Oh, I've got some cool numbers," but you didn't tell me how cool. I think that's so hopeful. Yeah, and your term new normal, like, we talk about in our class. I'm sure every foundational class that is taught amongst this audience here, um, you're always living with cancer, right? There's a change. The cancer takes things and gives things. And so life looks different after cancer treatment. Yeah, but it's life. That's what we're talking about, is our life looks different. Yeah. And so massage is different outside of treatment. And we now have the opportunity to be there for so many people on the other side of treatment, more so than what we had the opportunity to do even in the 90s. Yeah.
Mm-hmm.
If you don't want to rock it all the way back to 1975.
Yeah. I mean, yeah, there's a couple decades. Yeah.
Yeah.
So,
That's phenomenal. I didn't expect those numbers to be quite that awesome. Yeah.
I did a couple percentages, but when I started reading them, I was really taken aback. I thought that was really cool. Yeah.
Significant. Yeah. Thanks for that.
Yeah. So happy numbers there. So I think everybody has to find out what works in their practice, of course. I feel like my approach and Christina's approach, and probably a lot of others in this field at least, is a gentle approach to the body, of course, is usually the most best received, especially in the beginning with a lot of side effects. And then, as the vitality returns and less side effects aren't as present, then that's when we can start tiptoeing into dabbling in something new, or what used to happen, but maybe modified now, kind of idea. And I used to work at a chiropractic office. I'm not going to date myself. And she was very trained and had all the letters behind her name. And so she would facilitate traditional Gua Sha, the traditional Chinese medicine Gua Sha application. And so when she was busy, she would tell me the protocol, and I would then facilitate it on the body. So I felt very comfortable in my scope of practice to do that, because I wasn't treating an illness and I wasn't diagnosing. So and it was for the very healthy population. So it was a very different scenario than what we're talking about today. And when I went into private practice, I saw wonderful things happening in people from that experience. And I had this cool knowledge in my head, but I didn't know how to help people with that in my private practice. So I wanted to help people. And so I started kind of reading and looking at studies and figuring out, with the tools that I had from working with her, how can I help? And it really seemed like working with scar tissue was, in my scope of practice, the best way moving forward. And then with this population, it has been very helpful. It has been very delicate. It has been very well received, and not very taxing on them once they're ready for it. Like once their body is ready, once they're physically, emotionally, mentally ready to work on that scar. I think everybody in this area knows what I'm talking about. So we're all very well trained. So there's 4 stages of a scar healing, which I'll go really quick because I feel like you guys all know it, but if you don't. So the first one is you're cut, you're bleeding. Let's stop the bleeding. The second one is repair, clean out the gross stuff. 3 is fibroblast, meaning we're making connective tissue for the really tough scar. And then 4 is remodeling, or repairing or reorganizing. So the idea with gua sha, or scraping, is really what it is we're not really changing the scar itself. I'm not breaking down the scar. I've even untrained myself to use that words. What's the lingo that everybody uses? Breaking up the scar?
Oh,
Is that what?
people say they're breaking up a scar. And we kind of addressed that in our last class where we went, okay, hold on. Let's talk about the proteins in the matrix. We're talking about collagen. Collagen, ounce for ounce, is stronger than steel. You're not going to break steel. So let's talk about rearranging and realigning that tissue.
Yeah, thank you. Like, I can reprogram my brain to not even like use those words anymore, because the body is making that as a protective shield. And the body is so innate and so smart and genius that it's not going to let anything happen to that. So what we're trying to do is we're trying to help that scar in its organization of that kind of rebuilding, remodeling aspect, to where it's not going to overgrow, or it's not going to overzealously make too much of a scar, to where then it's going to put a pull on an area, so it's not going to like overdo. Sometimes, what do we call the body, Christina? A drama queen, and it
The body is
overdoes.
definitely a drama queen.
So we're just kind of like helping it realize, like, no, you're okay here. You don't have to do more. You're good. And so that's kind of the thought with this kind of work. When the body's ready, when the person overall is ready for the work, that's when, we go in there and we help facilitate that. Focus in on the scar when you're building it, when you're growing it. And let's make sure that it stays within the parameters it needs to, and it doesn't overdo. Yeah, especially with the, those very, very needed reconstruction surgeries, for obvious reasons. They are chosen for obvious reasons, but they leave a lot of scars. And, these people are not doing this for aesthetic reasons, really, but isn't it also to help them aesthetically? Like, I want to help them aesthetically. They've gone through this, very amazing, empowering, and otherwise you can put in all kinds of words, their journey. I want to help them the best that I can, and support them in the best way I can, even though they're not looking at it from a vanity standpoint. I want the scars to be okay and look okay and feel okay. Kind of all aspects of that too. And then also, I, just like everybody else, have probably seen during cancer treatments, a hip replacement, a knee replacement. Other surgeries happen along the way too. And so I feel like diving into that knowledge of how to help somebody rehab in a healthy body is good. How to rehab from a knee replacement surgery. That's easy, if I'm being honest. Helping somebody rehab from a full knee replacement surgery on chemotherapy, that's a different animal. And it takes a lot more patience. It takes a lot of patience to remind them to have patience. And so the healing is different. And so, yeah, I think kind of coming at it from a different aspect is helpful too.
Yeah.
Yeah.
And being patient enough to sort through that scar tissue as it's building. That's part of finding the new norm, right? Yeah. So, yeah, these are my limitations today due to sutures, bandages, whatever it may be. Then as we take them off and we get more mobility, then we get to, I know there are plenty of times, even though it's a very gentle approach. Sorry, my car turned off. Even though it's a very gentle approach, we're in a position where we can begin to remind the body of how it used to move in a safe space. And we all had that instance where a client is willing to let go and let us move an arm, for instance, with after a mastectomy, where they don't quite have the courage to do it themselves, you know, and then we can come in and begin to remind them. And then we can begin to work through that scar tissue once it reaches that that level where we can begin to work through it, being there along with them step by step, showing them that patience with the body through the healing process. I know it's a lot easier to be patient when you have someone sitting in the waiting room with you, right? Yeah.
True. Very true.
Yeah. So getting to see them establish that new norm from I just had a double mastectomy to I think I'd like to try moving my arm today, or I think I'm ready to begin to work on this scar tissue. That's a pretty rewarding thing.
Yeah. Very much so.
Yeah.
I feel like I ran through the gua sha thing really quickly. Does anybody have questions? I don't know.
Yeah, I wonder what the level of training is on gua sha or scraping or Graston. There's so many different animals and everybody's coming from different backgrounds. Is there anybody in this meeting now that uses gua sha or any form of scraping? Okay, so we're talking about a new idea then. That's exciting.
Well, I was trained in it, that it was the 80s in San Diego at the Pacific College of Oriental Medicine. And they did it very different than what I see massage therapists do today. So go on. It's scar tissue work now, right?
Right. Was it breaking up scar tissue back then? No.
No, it was all about just getting the skin to move, bringing in nutrition and circulation into the tissues, and entertaining the nervous system to bring attention to that area. And so they weren't leaving any bruising or stripes. They would get it pink and then it would go back pretty quick.
Okay, Amy. So with that framework of familiarity, now can you kind of talk about the difference now and the similarities? Because she's thinking about gua sha with stripes and bruising. So that's a little bit different framework.
Yeah. That was mostly acupuncturists and doctors of oriental medicine that were doing that as well. So not
and so that is definitely a traditional Chinese medicine approach. That is a energetic approach to the body and an approach to heal the body. And so that is out of my scope of practice, because that's when you're treating an illness and you're diagnosing an illness. So that's not something. I have a massage therapy license that I can't do that. So if a massage therapist is working with somebody with that license, I guess it's up to them if they feel that they are working within their scope of practice in that business. But that's not something that I do. I do not leave any marks on my clients. That's not part of the therapy. If I'm doing scar work and something is getting warm to the touch, I'm done. That's the level that I stop at, because the body is reacting. Histamines are coming to that area. That means inflammation has started. So we're cutting off, no matter what time it is, how long I've been in that area. We're done today. Yeah. So and it's just because that's within my scope of practice. That's me ethically with my training.
It kind of reminds me of we have gua sha, and then we have gua sha specifically for scar tissue and surgical rehabilitation. Gua sha for scar tissue falls within our scope. Then you also have cupping, That's another thing that has kind of gotten Western rebranding, kind of, if you will, right? So we have cupping for Eastern practices. It's more spiritual, it's more energetic, it's glass cupping, fire cupping, that kind of thing. But then whenever we do, say for instance, myofascial cupping, it's not energetic, it's a different approach. So if you guys have been exposed to those two different types of cupping, the same thing here. When we use the term Gua Sha, it's for scar tissue and recovery, not for the same energetic and spiritual reasons. So yeah, in that way, I think it's very similar to what you were learning back in the 80s. It's a gentle approach. It's mobilizing the skin. It's facilitating the body so that it can reorganize that scar tissue in a more functional way. Yeah.
My ideas for 2025 for me and my practice is now I'm trying to educate myself better on new approaches, new gentle approaches on how to help the body move for my clients.
I wonder if there's any questions, or if anybody, I mean, I like the less of a lecture and more of a forum type format, right, Amy? So
yeah, I mean, I guess I could show what I use.
Yeah,
that's kind of fun. Show and tell is always fun.
Show and tell is fun, especially when the tools are not what they're expecting.
Oh, okay.
So
I'll go with the expected.
When we do our Gua Sha for scar tissue class, we give them a little box of tools, and it's always fun to step back and watch the students open their box of tools. I assure you, it's not what you expect. Yeah. Take it away, Amy.
So I'll do the first one, kind of like the expected ones, like the ones that we kind of see, which is kind of like the Jade tool. Yeah, it's very smooth. It's very it can be cool in temperature. Yeah. And it's kind of it's rounded. So it's very soft on the surface of the skin. That would be it would feel more broad on the skin. And then we have kind of a comb looking one. Some of my clients have really liked this one, like when their hair is growing back in, it feels really fun. It feels like a deep itch on the scalp. They like that one. So, this one I use a lot. If you can see, it has, maybe if I get out of the way, I don't know, maybe not. It has like little teeth. So it has like the soft edge, but then it has the teeth, and it feels actually really good over the scar area. I promise, it looks violent, but it's not violent. I promise.
Amy, is that one of the resin tools that we had made?
Oh no, I should get one of the resin tools. Oh yeah, can you tell them about the resin lady?
Yeah, so Jade got a little expensive, and for those of you that teach, sometimes budget is a little cost prohibitive, especially when you're providing supplies. So we needed to find another way to produce this tool for our students, and Amy found a woman that made resin products. She showed her the Jade scraper that she had, able to replicate it, which and it has a nice cooling effect. For those of you that use crystals in your practice and things like that, of course you don't have those features of the natural stone, but you have the cooling effect, you have the same shape, the same contours, and I really like using it. And also, it doesn't break. I bet I break one Jade tool a month.
Yeah. It's more sustainable. Yes.
More sustainable. I like the buzzword. Thank you.
That's a hot ticket word right now, right?
Yeah. So that is also a more cost-effective.
So Christina, I'm sorry, I'm showing the tool. You're going to have a flashback, so just close your eyes. So this is a good tool. So Sorry. See how just somebody has a deep flap, their little belly button, they don't want it to grow back in. So this is a good tool to use inside the belly button so it doesn't grow back in. I was demoing. Can I tell Christina? Christina's usually my demo in class. And I was demoing on the table and I was talking about it. And then I forgot to warn her that I was going to demo that in her belly button. And I think she would have punched me if people were not around. So, yes, I learned my lesson. Okay. Next are the unexpected tools, but surprisingly amazing. It is a soup spoon, a Japanese soup spoon. The handle is very pointed if you want to be very focused. And then this mimics kind of that Jade tool. And it is a cooling effect too. And it actually is more ergonomical on my hand than trying to hold this guy, especially with oil if you use oil. So it feels better in my hand and it doesn't fly away like the other ones do. When I took some of the seminars, they had Snapple bottle tops or baby food bottle tops, but I got this on Ualine. It's like just a baby food bottle top, and you just kind of hold it like this and you scratch. It actually feels really good. All right, and my favorite one, a quarter. My favorite. I don't do it a lot. It's for I don't do it everywhere on big spaces. It's more like little areas. So I have a scar right here. Thank you, children. And I work on it like little itty bitty areas. So it's very very focused work, but I like the ridges on it. It feels very nice. And everything gets cleaned with soap and water. It's pretty easy. So, yeah. So in the traditional sense, where this comes from in the Eastern culture, this is a home remedy. This is not somewhat, you don't go to somebody to have this done. Whoever's in the house usually just picks up something in the kitchen and starts scraping you. So it could be kind of coining. It could be, they could just grab a spatula. I don't know, like anything. They just grab anything in their kitchen and start doing this now. That's why the tool itself, you don't have to spend a lot of money on it. You can, it could be very fancy. But I want to say the restaurant supply company, we get like 50 of these. I want to say it breaks down to be like 50 cents per, I think. I mean, for an individual practice, you might not need that many, but so, and a quarter, just clean it really good and use it, probably have one in the floor of your car. So, so yeah. The biggest difference between, from my understanding, and anybody can correct me because I'm not super, knowledge doesn't stay in my head forever. The biggest difference between Graston and Gua Sha, one is the approach, which is energetic in nature, and Graston is more neuromuscular approach and it's Western. And then the tools. So Graston is those big, really heavy metal tools, and they are very proud of them, and they should be. And they have a very big price tag on them. And I tried using them, and they just flew everywhere. I don't know if it's me or how they're made, or I don't know. So I can keep a quarter in my hand though, so that's good. That's what works for me. So. But if you ever have a chance to use some of those Graston things, I mean, they're hefty. But it's more for like ligaments or muscle bellies. It's definitely a different approach. And I did a shadow chiropractor that was trained in it, and it looked very aggressive. So I did not look more into it personally for me. So yeah, but food for thought, just because I saw one person, I'm not going to never look at it again, but that kind of, I might eventually go back and look at it. I'm not, never say never, but I like gentle approach. I think that's why this speaks to me so much, because it is very gentle. Did you like the show and tell?
I have a question.
Okay, I hope you have an answer.
Are you getting referrals from physical therapists or oncologists, surgeons for this?
So I do have a network of referrals for my practice that I've kind of set up in a little bit of vicinity from my private practice. I have an outpatient lymphedema clinic that we refer back and forth to each other. I'd have to look to be sure, but I want to say there's about 4 oncology. I think it's Texas Oncologies that we kind of I get referrals from, and then there's a couple PTs that referral back and forth, and then there's additional Chinese medicine practitioner that is a referral. I have a functional movement coach that I refer to. I have a nutritionalist that specializes in chronic conditions, but also has a lot of knowledge on cancer needs, so to speak. And then, wait for it, a couple couch therapists that help with cancer-related help. Yeah, so I try to get a lot of resources because I know that the oncology offices are very busy, and I don't fault them for not having enough time to sit with everybody. So I try to be a resource if I can, or have a resource. And I'm always looking for more people to network with. Yeah. And what I do also is, if the client wants, I tell the office that referred back and forth to me, is I kind of have a template. Like, we do the soap notes, like we do our little, after session thingies. I try to make them detailed, and not really great with grammar. So thank God my computer can help me with that. So I have like a template, like the top and the bottom is kind of the same. And in the middle, I just copy paste my soap notes. And then I send that to their doctor. So their doctor knows kind of what happened and how they came in. If they needed to talk stuff out for about 30 minutes and they only got about 30 minutes of work, hands-on, kind of thing. Just maybe kind of where they stood when they came with me. Recently, I had a client come in, and she was kind of worried about this area over here or something like that. So I put in the notes like, hey, they were kind of worried about this. I'll follow up with them, and I'll let them know that if it persists, that they really should talk to you, just in case, just kind of like just backing them up, I guess, just reiterating that, like, if you're concerned about it, go call your doctor, kind of thing. But just kind of letting them know that I'm here as a resource. I know it's not super medical, but this is what's happening with your patient. And some of my clients really enjoy it. I don't know if they ever read it, but it's going to them.
So are you doing HIPAA forms when they come into your practice that they sign to give you permission to send the information to their doctors, or who to send the information to?
So it's in kind of my like consent part, because it's not really any like personal data per se. It's only what happened in that session. So what it is kind of like the consent says, if you agree for me to disclose with your oncologist or primary care physician or PT, I kind of listed out everybody there, that, what happens in our session, I would be more than happy to do that. And they said that's fine. And so then I sent it to them. Because I'm not sending demographics. I'm not sending, I'm sending their first name and their last name, not sending date of birth. So yeah. So far, everybody says I should be good. So hopefully that's still true.
Does anybody else have any questions? And are you're teaching this class at your office in Texas, but are you also traveling and doing that?
We don't, I mean, we have kind of a home base to teach at in Plano, Texas. It's a massage supply store and training center, but we are mostly nomadic. We kind of teach wherever we're told to go and wherever people want us to go. So yeah, almost all of our classes are in that thing, the national approved. So we can take our classes anywhere. I think the only one that isn't is the lymphatic, abdominal, and breast drainage, because that's not allowed to be nationally approved because of their guidelines. So I think that's the only one. So yeah, all of our classes, we can take them anywhere if that state approves the national credits. And then also in Texas. So yeah.
Okay.
Yeah, it's more of like, I want to pique the brains of oncology massage therapists to think about how can you help your clients after treatment's done. Like that's the curiosity I want to pique with this topic, you know? What can we do to help them get better? Feel better.
I think lots of things. Is everybody here working with people after treatment or only treatment?
Amy, I have a question.
Okay.
Joe here. Are you teaching clients to utilize these tools themselves at home as well?
So not the scraping, because one, it only takes one. They went a little too zealous. So I give them other things to do.
Okay. Yeah,
But
I mean, it's very helpful / not helpful a lot of times, right? I find that a lot of people watch the videos and then they just go crazy and they get the marks and they get, the bruising and everything. So I teach a lot of like massage balls or foam rolling sort of stuff, but I'm very, very clear on like, it doesn't have to hurt. And most of the things you see on YouTube are really bad. And I've even gone on to like creating my own digital videos to provide people because it's just so ingrained that people do overdo it. And so, especially with a cancer survivor, I could see, with lymphedema risk and anything that could be an even bigger can of worms that I would be concerned about. So I was just curious. Thank you.
Yeah, that's a really good question. Yeah, I don't encourage this homework for sure. Yes.
I think a lot of people here may not just be working with people in treatment. So if you're working with people after treatment, raise your hand. Yeah. So yeah, we're all doing that, I think. Yeah, we may not be doing gua sha or cupping, but I think we're all doing that. And the thing is, with massage therapists and foundational class, I think sometimes when we're first starting out working with people in oncology, we get stuck in ruts. We get stuck in spaces where it's like everybody we're seeing has breast cancer or da 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 da. And so as we get more experience and of course lifelong learning, more and more classes and more networking, we get to work with more people with different cancers and different situations. And I'm still watching out for people to say, no, you can't come if you still have drains. So
I have another question. How
Yeah.
do we know, I don't have any Gua Sha training at all. I don't utilize these tools so I have no knowledge. And so hearing this tonight is great because otherwise I'm just like what I see on, social media. And I'm like, that's a horrible idea. You should not do that. And so this is fantastic. But how do we know, the training and like what style people are using as far as like if I wanted to refer a client to somebody to do this if I don't know, or if I do decide to take a class, like how do we know which ones are quote unquote safe?
Yeah, so it would be kind of in their description of the class specifically. So if they have kind of, because I've taken a lot of them too, just because, I don't know, I'm a never ending student.
Mhm.
Like one that just says, Gua Sha. Well, that's a big can of worms. That's going to be a huge mountain, and especially if it's just for massage therapist, that was kind of like a big rabbit hole with a lot of wild wild west stuff happening in the classroom. So it was a very broad topic with a lot of broad things happening in the classroom. And I think that's why me and Christina were trying to be very specific in our description and our title. So maybe look for the more specific titling and more specific descriptions.
Mhm.
And I always tell students or prospective students, if you have that option, get the work done from the instructor.
Okay.
Because then you'll know without a doubt what you're getting in for.
Mhm.
Because I offer that as an instructor, and Christina does too, in our practice. Like you can have a session with us to see what it's like before you take our class.
Okay.
So, I mean, that's ultimately I think that's the best way to know what you're getting into.
Okay. Thank you.
I also say look at their social media and any YouTube videos because some of them, they really do put some pictures of some bruising and stuff on there, and you can kind of tell if they're really taking that gentle approach where it's just getting warm or barely turning pink or not. And you know, that's kind of a big sign right there, especially if they're doing that and saying, look, there's all this stuff coming out of the body. That gets kind of scary. Anna's like shaking her head. I'm not the only one that's seen that one.
Which I'm going to be very honest, if it's an energetic approach, that can be very valid. But that's not my training and that's not my approach. Yeah. Because then you're diagnosing. Yeah, that's a good question.
Yeah, I'm sorry we lost Christina there.
She
And
was probably driving.
yeah, so she ended up in a dead spot or something.
Yeah.
So
The
please
role
tell
of
her,
mom.
please tell her that we missed her. And
Okay.
we're so thankful that you guys both came in and visited with us. And like I said, next fall, I hope we get to see you at the convention, the AMTA convention.
Oh,
Yeah, it's going to
yeah.
be in
It's in
Dallas.
Dallas.
And
We're
so
you
it's a
you
great place to network.
I am on the board of the Texas AMTA chapter, so I have to be
Are you?
there. Yeah. So
Great.
yeah.
You were just in Tampa then?
hmm
Okay.
Yeah, I'm a delegate, so I got to do like, the chatting
Yeah,
and yeah.
the fun stuff. Yeah. My husband and I taught in Tampa, but we didn't want to teach in Texas because we have too many friends.
Got it.
Yeah.
Oh yeah, you couldn't keep me away from a Dallas national convention. Shoot. No.
Yeah.
I'm still gonna get like a little place near Dallas because I live like in McKinney, which is close to Oklahoma. And I kind of want to just have a time away. So
Yeah.
mhm. Yeah.
Yeah.
But
But
then
yeah,
lots of S4OM.
yeah. But we thank you so much for being with us. Can you put your deets in the chat?
Like,
So
yeah, all my
put
information.
out like yeah, like if you have emails, if anybody wants to get in touch with you or anything.
The best way to get in touch with us is everything is on our website.
Okay. So we'll just look up, we can go to S4M and look under the foundational groups and find Emerald.
Yes.
Why
and
did
I'm
you
also-
name it Emerald?
So me and Christina thought that we were gonna like embroider things. So we wanted it to be like a cute, like matchy, like a bookendy kind of name. So we wanted EBE because we wanted bodywork education. Education. And then we wanted to have an E, the first word. And there we go.
Yeah.
And so we're like, well, like we were using thesauruses, we were using Google. We're like, we can't figure out the first letter, like the first word. And eventually, again, I was like frustrated as I'll get out. And I was kind of talking this and that, and then it came to be that the heart chakra, the color emerald, and me and Christina are both passionate about teaching. So it came to be Emerald, and our tagline is education from the heart. So it came all together after a lot of frustrating hours. Yes.
That's beautiful. Thank you for sharing that with us too.
But I really appreciate everybody's time. Thank you so much. I know that this is a volunteer role. So thank you, thank you, thank you.